Selma, this cruise ship is expected to dock in the Canary Islands this weekend. What exactly is going to happen?
This is a really complicated and sensitive operation to get these passengers off the boat safely, of course, while also keeping them in isolation. It's something that the Spanish authorities have continued to address. There is even protests on the Canary Islands against the boat docking, so you can understand just how sensitive of an issue it is. Now, Spanish authorities say they have an ironclad system in place. It's going to be a closed circuit loop. There are medical facilities and medical personnel waiting to provide treatment to those who need it, waiting to provide any support that may be needed. They're going to have special entrances to enter those medical facilities that are specifically prepared for these passengers. They will all be seen, treated if they are needed to be treated. And then the other element to this, the part two of this, if you will, is repatriating those citizens to their individual countries. You have more than 20 different countries among more than 140 people. So Spanish authorities right now are speaking to each of these individual nations to figure out what their plans are for bringing their citizens home. Let me give you the UK as an example because they're monitoring several cases. They have 3 suspected cases right now that they're monitoring. One is in a hospital in Johannesburg, one is a hospital in the Netherlands, one is on an island, a remote island in the Atlantic, and then they're dealing with several other Britons who are on board that ship. They're speaking with Spanish authorities about providing specialist flights in order to evacuate them. And then once they arrive here in the UK, they're going to be asked to isolate for 45 days. But this is a mammoth operation and a very complex mission.
It certainly is, Selma Abdelaziz. Thank you so much. And let's go live now to CNN's Pau Mosquera in Madrid. Pau, what are Spanish authorities saying about this hantavirus outbreak ahead of the cruise ship docking?
Well, Pamela, they have been trying over the last hours to reassure the local population that there is no risk of contagion, or that at least is very low. A message they have been also sharing with the regional authorities that they have opposed of the ship docking into the port of Granadilla de Abona. And actually, to demonstrate that everything is going to happen safely, they have finally defined the protocol on which they are going to transfer all the passengers from the boat to the respective countries. In the case of the 14 Spanish people that are on board of the cruise ship, they're going to be taken here to the Spanish capital, and actually they're going to be moved to the hospital that you can see here behind me. This is a military hospital, and in the very last floor of the building they have a high-level isolation unit that they are going to use in case that they detect any symptomatic case between these 14 people that are going to get here. So far, none of the passengers or crew members that are on board of the MV Hondius is symptomatic. All of them are asymptomatic, but the authorities have confirmed a few hours ago that there's the first suspected hantavirus case in the country. It has been reported in Alicante, in eastern Spain. It is a person that reportedly shown some symptoms that were consistent with hantavirus. They have performed a PCR test and they are now waiting for results, Pamela.
All right, Pau Mosquera, thank you so much. And let's head to Buenos Aires, Argentina, where CNN's Ivan Perez Armenti is standing by. Ivan, it's still not clear how this outbreak started, but the WHO is looking at whether the Dutch couple who died were infected while sightseeing in Argentina before that cruise. What more can you tell us about that?
Hi, Pamela. And the Argentine Ministry of Health is currently reconstructing the route taken by the couple identified as the index case of this hantavirus outbreak. Investigators are working to pinpoint the exact origin of the infection. Let's remember that the ship set sail from Ushuaia, the southernmost city in the world, on April the 1st. However, authorities have not yet confirmed that the contagion occurred within Argentina. The virus has an incubation period of 1 to 8 weeks, and the couple had recently traveled through other Latin American countries before arriving in the south. Since hantavirus in Argentina typically develops in specific rural zones, the leading hypothesis is that the passengers may have contracted the virus elsewhere, and the infection was only discovered once the ship was at sea. Ushuaia has a population of about 80,000, and it's the capital of Tierra del Fuego province, an island at the southern tip of the continent separated from the mainland. According to authorities, there has never been a reported case of hantavirus in the province. Because of this, the local residents we spoke with are highly surprised by the news. In a small community like this, they say word of such a case would have spread quickly. Most infections occur primarily through the inhalation of viral particles from the feces, urine, and saliva of infected rodents. However, the World Health Organization confirmed that the variant infecting the cruise passenger corresponds to the Andes strain, the only known to be transmitted from person to person, which circulates here in Argentina and Chile. And until now, the Ministry of Health reports 24 cases so far in 2026 and 101 during the latest epidemiological campaign, which ran from June to June a year. This figure is nearly double the 57 cases reported in the previous period.
Dr. Schaffner, thanks for being here. So the World Health Organization is downplaying that hantavirus is similar at all to COVID. Listen to what one official said earlier today.
This is not SARS-CoV-2. This is not the start of a COVID pandemic. This is an outbreak that we see on a ship. There's a confined area. We have 5 confirmed cases so far. We completely understand why these questions are coming, but this is not the same situation we were in 6 years ago. It doesn't spread the same way like coronaviruses do. It's very different.
So, Doctor, what is your takeaway here? How contagious is this?
Well, I think, Pamela, that this is indeed a rather contained phenomenon, and it will not provide a COVID-like epidemic that went global as COVID virus did. This is a virus that usually is not transmissible from person to person, but this may be a distinctive Andes strain, a South American strain that can, on occasion, be transmitted from person to person. But so far, it's a very confined circumstance to the passengers on this cruise ship. Those who have been disembarked are being watched by public health authorities in their home countries.
Right, because the last I read, it was announced by a Dutch official that nearly 40 people disembarked after the one passenger died and it became clear there was a virus. And so what is your concern in terms of tracing and going back and seeing who all those people came into contact with? And do you have concern that this virus could mutate and become more contagious?
Well, as to mutation, I don't think we have to go there. There's no indication that this is a rapidly mutating virus. This is another instance that emphasizes the importance of global public health, the World Health Organization, and then working with national public health authorities. They're following these disembarked patients very, very carefully. And I shouldn't call them patients. They're persons. They're healthy. At the moment, none of these folks who have disembarked have become ill. So far, so good.
What is your concern, though, that the incubation period is up to 8 weeks? I believe it's 1 to 8 weeks.
Well, it can get as late as 8 weeks, as long as 8 weeks. But again, the local health authorities can watch this very carefully. These people are being cautioned to be careful themselves, not to get into crowded environments, so that should they become sick, they won't transmit it. And remember, this is a virus, although it can be transmitted from person to person, it doesn't do so readily.
So the World Health Organization says that 2 top epidemic experts, or 2 Dutch infectious diseases experts, I should say, were joining the ship. In your view, has this outbreak been handled appropriately so far?
I think so far, very, very well. This very unusual diagnosis was actually made while the people were at sea, and then the passengers were put into isolation while at sea in order to prevent further, if any, person-to-person transmission. Local health authorities have been notified of everyone who disembarked. Those people are being monitored carefully. So I think this is an example of international collaboration dealing with what we trust will be a confined circumstance. So far, so good.
So far, so good. We hope it stays that way. Of course, we don't want to be an alarmist, but I think a lot of people have curiosity about this. But why would the ship allow nearly 40 people to disembark when you have this virus. Was that a good idea?
Well, at the time they disembarked, I don't think they were clear about what this infection was, that it was contagious. And so this was a developing story at the time. These people who disembarked probably signed up for only part of the cruise, so they weren't intending to stay for the whole time. Now there are more people who would like to leave the ship, obviously, but I think the decisions that were made at the time were perfectly reasonable, and we always have to give people a little bit of confidence that as more information comes out, the recommendations may well change. And that's true of this circumstance because it is a rapidly changing circumstance.
It's believed that this strain of hantavirus on this cruise ship is called the Andes strain, which is the only form of hantavirus that can be passed human to human, though it's still rare. What do you think so far about the way the outbreak is being handled and contained?
I think we've been getting fantastic information from WHO, and I think it's especially notable given that, as was just reported, the cases are really potentially going to be found perhaps all over the world if we do see transmission that is related both to the cruise ship and to the subsequent airplane travel. I would like to see more frequent updates from the US government. CDC has been quite silent, as I think you know, and they've traditionally been a very prominent voice in these types of outbreaks. But in general, the inter-country cooperation, particularly with the South Africans sequencing the virus and all of the other folks who are really working hard to take care of the disembarked passengers, has been a pretty model response.
There were American passengers on that ship who have disembarked and are currently being monitored for symptoms in states across the country. They remain asymptomatic at this time, we're told. Why do you think Americans have only heard from state-level health officials and not the HHS Secretary Robert F. Kennedy Jr. or anyone from the CDC about this yet? Is that appropriate for this stage?
Yeah, I would be speculating if I knew why we haven't heard from CDC or its parent agency, HHS. We do know that those agencies have been decimated by both the funding cuts and the staffing cuts in the last year, including the section at CDC that's responsible for cruise ship screening, hygiene, and care of patients who might have contracted an infection on those vessels. So I don't think it's surprising, sadly, that we haven't heard. Again, state and local health authorities have also been affected by some of these cuts. So I really hope that everybody can continue to step into the breach. There is a big information gap from the federal government, and we need to really pay attention. The follow-up of the patients, I will just mention, the passengers who are at the States, a little bit complicated because one of the things we've been hearing and talking about is that the incubation period of this virus, remember that's the time from when you get infected to the time that you show symptoms, can be as long as 7 weeks. In the outbreak involving the Andes virus in Argentina, it didn't really seem to be that long. That was 2018 to 2019, around a week or two. So even though we're technically concerned for a long period where people might show symptoms, hopefully if people do get sick, and I fervently hope they don't because this is not a good disease, they will evidence those symptoms within the first couple of weeks.
So there are people making comparisons between this situation and the early spread of COVID. I am not making those comparisons, but we see a lot out there. Some even experts are saying things like this. Anxieties are building in response. The public is concerned. What is your message to members of the public who might be feeling nervous about this becoming what we all went through with COVID?
Yeah, I mean, one can't help but have deja vu, and it's not a pleasant deja vu, as you well recall. I would say that every new outbreak starts with the detection of cases that are unexpected, right? Think back to COVID, the early days, not just in China, but in Seattle, where we saw the first cases in the United States. Those were treated as outbreak investigations. It became very clear very fast that just tracing the chain of contacts, which is what you do in an epidemic investigation, was yielding many more cases, and then it went out of control and it became clear it was turning into a pandemic, right? The chains of transmission just blossomed like crazy across the population. It became a pandemic, and now it's endemic as a respiratory virus. With this infection, if there is good news, and hopefully there will continue to be, the chains of transmission should be pretty limited. We are tracing specific contacts who were in contact with potentially infected people, hopefully for pretty brief periods of time. And ultimately, that chain is very likely to end. So we're not going to see, hopefully, this sustained carryover infection through generations of exposed passengers, and this will eventually die out. Hopefully that will happen before we see any more deaths and before we have to get into the quarantining or isolation of more people.